The objective of this video is to look at the blood vessels in the abdominal region as well as those that are serving the lower appendage. To orient ourselves to the view I've got on the screen here, this is the very bottom part of the heart. Here's the apex. And recall that the inferior edge of the heart is going to run right up against the diaphragm. So the diaphragm is tucked up under the rib cage, kind of up in this plane or so, shaped like a rainbow. And the abdominal organs are omitted from this chart, but it shows the blood vessels that would run into each one of them, even though it's absent. So under the diaphragm, the liver is tucked up under the rib cage and up against the inferior surface of the diaphragm on the right side of the abdomen. And then the stomach and the spleen and most of the pancreas are more toward the left side of the abdomen, kind of in that same area. So the largest red vessel that comes through the diaphragm and down into the abdominal pelvic cavity is then called the abdominal aorta. And the largest single blue vessel is the inferior vena cava that's going straight up into the right atrium of the heart. So if I start with the arteries, the first exit off of the abdominal aorta is going to be the celiac trunk, which is a pretty short little branch of an artery that comes out and then branches 3 times almost immediately. The left gastric artery is shown here, kind of going vertically up on what would be the backside of the stomach. The common hepatic artery is headed off to the right, headed for the liver. Hepatic means liver. And then the left branch off of the celiac trunk is headed over for the spleen. That's this splenic artery right here. All 3 of those have veins running alongside them. This is the splenic vein. This is the left gastric vein. But where it gets a little tricky is alongside the common hepatic artery, the large blue vessel going into the bottom of the liver is the hepatic portal vein. And then the hepatic veins emerge from the top of the liver, which would be right up against the bottom of the diaphragm and very close to the bottom of the heart in terms of horizontal plane. So these are the hepatic veins, whereas this is the hepatic portal vein. As I come down the abdominal aorta just a little bit, this is the superior mesenteric artery, which comes out of the abdominal aorta and cascades downward like a waterfall. And then running alongside it is the superior mesenteric vein that's going to run into the hepatic portal vein. Very close to where the superior mesenteric artery emerges from the abdominal aorta are also the renal arteries and veins. On the left side here, they're at the back, they're going to the kidney, which is toward the back side of the abdominal pelvic cavity. And so this is the renal artery on the left and the renal vein on the left. Here's the renal vein on the right and the renal artery on the right, right behind it. Coming back over here, coming down the abdominal aorta, this last exit, which is quite low, is the inferior mesenteric artery, which is going to come out and kind of branch to serve intestines lower in the abdomen. And here is the inferior mesenteric vein. So right where the artery emerges from the abdominal aorta, it looks like the vein is nowhere to be seen. But this wall chart gives us quite a nice view of how at the intestine, the artery and the vein are running alongside each other. But the inferior mesenteric vein needs to go up and merge into first the splenic vein. And then once those two are merged, the splenic vein is going to run into the hepatic portal vein. So that inferior mesenteric vein needs to go to the hepatic portal system, and it does so by way of the splenic vein. Then we come to the split at the very top of the pelvis, and what's nice about this wall chart is it gives us the bones so we can see the iliac crest of each of the coxal bones, and we can see that the abdominal aorta splits right where those are. So the split makes the common iliac artery. And then the common iliac artery splits again to the internal iliac artery, which kind of goes into the medial portion of the pelvis. And then the external iliac artery stays more lateral and is going to emerge from the pelvis and go down into the thigh. On the venous side, everything is running right alongside. So we have the external iliac vein and the internal iliac vein that merge into the common iliac vein, and the two common iliac veins merge into the inferior vena cava running up through the abdomen. So continuing with the blood vessels that serve the lower appendage, as soon as the external iliac artery emerges from the pelvis, that same tube becomes the femoral artery. The deep femoral artery is the smaller branch off of the femoral artery, which runs more lateral, kind of goes around the thigh, around the femur. And femoral artery continues through the thigh. And then as soon as that tube is running along the backside of the knee, it's going to become the popliteal artery. And we can see the bones, so we can tell where the knee is. But this would be the popliteal artery. And then it's going to branch a few times in the leg, and we are learning those branches. This leg is rotated laterally, so the toes are pointing laterally here. And I can see that This allows me to see the posterior tibial artery and the fibular artery that make the distalmost branch point. And on this side, I can see the popliteal artery. Then I can see the anterior tibial artery, which makes the more proximal branch in the leg, with the anterior tibial vein running right alongside of it. And toward the back, I can see just a little tiny bit of the fibular artery and vein, and more on the medial side of the posterior tibial artery and vein again. Small saphenous vein runs up the lateral side of the leg and merges in with the femoral vein above the popliteal vein. And it's quite tricky to find on this chart, but it's shown here kind of in that opaque view, meaning that it's behind everything here because this leg is rotated laterally. So this is really not the best place to ask about it, but it is this number 106 here that comes in and merges above the popliteal vein with the femoral vein. The other extra vein in the leg is the great saphenous vein, and the great saphenous vein runs up the medial, more superficial surface of the entire leg and thigh, and it merges in with the femoral vein quite high in the thigh. So this large vein here on either side is the great saphenous vein. And again, here is the femoral vein. The popliteal vein was behind the knee. Femoral vein runs up kind of the middle of the thigh. Great saphenous vein comes in and merges with it right below the pelvis. And the deep femoral vein ran alongside the deep femoral artery near the top of the thigh. And then where the femoral vein passes into the pelvis, it becomes the external iliac vein. Then the internal iliac vein comes from medially in the pelvis and merges with the external iliac vein, becoming the common iliac vein. And then the two common iliac veins merge to the inferior vena cava that runs up through the abdomen and up toward the heart.